What is an emphysema exacerbation in COPD? Have you ever wondered what happens when someone with emphysema experiences a sudden worsening of their symptoms? This situation is known as an emphysema exacerbation, and it can be quite serious. Emphysema is a type of chronic obstructive pulmonary disease, or COPD, that involves damage to the air sacs in the lungs. When an exacerbation occurs, breathing becomes much more difficult than usual, and this can last for several days or even weeks. During an exacerbation, the underlying damage from emphysema leads to increased inflammation in the airways. This swelling can cause bronchospasm, which is when the muscles around the airways tighten. Additionally, there may be an increase in mucus production, which further narrows the airways. All of these changes make it harder for air to flow in and out of the lungs. So, what symptoms should you look for during an exacerbation? Increased shortness of breath is often the most noticeable sign. People may find it much harder to breathe than they typically do. Coughing may also become more frequent or severe. Changes in mucus can occur as well, such as a thicker consistency or a different color. Some individuals may feel chest tightness or heaviness, and wheezing or noisy breathing can be common. Fatigue is another symptom, and in some cases, a fever may develop if an infection triggers the exacerbation. Exacerbations can be triggered by various factors. Respiratory infections, whether viral or bacterial, are common culprits. Exposure to irritants like smoke or air pollution can also lead to these episodes. Cold air and other environmental factors may contribute as well. When these triggers cause inflammation in the lungs, the risk of complications, such as cardiovascular events, can increase. Managing an emphysema exacerbation requires prompt medical attention. Treatment options may include antibiotics if an infection is present, corticosteroids to reduce inflammation, and bronchodilators to help open the airways. Oxygen therapy might be necessary for some individuals. It is also important to rest and avoid any known triggers. Because exacerbations can lead to permanent lung damage and worsen the overall condition, preventing and treating these episodes quickly is essential for anyone living with COPD. Recognizing the signs of an exacerbation and seeking help can make a significant difference in managing the disease and improving quality of life.